are here to really emphasize that exercise can be the gateway to many possibilities for your children, students, and adults. Ashley, they have been watching different routines, different exercise and strategies. We've talked earlier about sport, the difference. What are some of the changes that you've seen with your students, with Dylan, with all the other kids that you've worked with or adults that we've worked with that go beyond fitness?
For the most part, exercise in general is a lifestyle change for everyone. It's not just exercise, but it's also the health as well, the health component. So you have their diet as well as the exercise, and in essence, it's one entity. So knowing that we're tackling both the exercise, we're also tackling the health factor, which for anyone is a huge lifestyle change. With that, with a lot of the individuals that we have worked with, I saw the confidence, most importantly, but that confidence didn't just come naturally. It came because of us building that relationship with them and letting them know that they can do this, they can make it a part of their lifestyle, and they end up taking ownership of that because they know internally it makes them feel good, and it's something that they have control of.
And I think that you bring up a great point is that, we hear that a lot is sometimes parents will ask us, what is my child going to see from this? Or in the education world, they want research and they want data. And it's really, really hard for us to measure the confidence. But we know it. You may hear Dylan's mom talk about it, of how exercise can improve and boost that self-esteem. You're going to hear Rachel talk about these things. And while it may not be measurable data that we can analyze, we see it. So we encourage you, again, challenge your students, challenge your children, challenge your adults with exercise. The other thing about exercise being the gateway to many possibilities is that occupational therapy, physical therapy, they eventually end for multiple reasons. One, which is a great one, is that these children may graduate and they may succeed and meet their goals, but sometimes that movement then stops there, and parents sometimes don't realize how impactful exercise can be, or like you said, it's a lifestyle change. So engage students, continue to engage them in exercise, and OT and PT are not the only avenues for them to move. So exercise. What else?
I think what's really important as well with the OT and PT, as much as it is going to end, what's nice about the exercise visual system is we are teaching skills as well. So a lot of these skills you'll see, especially with Dylan as well, we are working on penmanship. We are working on fine motor skills that these in essence can also be done while they're learning and while they're going to school, and eventually it will catch up to them when they become adults and they are in the working community, that these skills are coming and going along with them. Yeah,
and speaking of work, you're going to hear it from Anthony. You're going to hear it from Rachel. Anthony is now working at a grocery store. Rachel is speaking nationally about her journey through exercise and having autism and being diagnosed with autism. But exercise can lead to better jobs. That structure, that routine that we teach here, that you see, whether it's in the classroom like this or out in a gymnasium, that structure and routine is same like a job. When your kids go and they have to have a schedule, they have to be there at a certain time, just like when you go to Dylan's house, you're there at 1 o'clock till 2 o'clock, or I'm with Rachel from 3 to 4. It gets them used to that structure and routine of a job. So definitely very important. One thing that we want you to understand is that exercise does not and will not replace occupational therapy and physical therapy. What we are doing should work in conjunction with all of that, and something that we can teach to our children so they can carry it on for a lifetime. So if there's questions, comments, anything that you need, please contact us at the Exercise Connection, and someone is always answering the phones at NCHPAD. Please reach out if you need more help or more support. And remember, always challenge autism with exercise.